I hope you all can see my screen. The mind maps also I'm sharing are for the direct retainers, and entire prosto mind maps are also created. The all the hot notes, all the hot topics of prosthodontics, the mind maps have been completed, and soon they will be designed and will be uploaded on the app as well for you to have a quick revision. And this coming week, you will also have the Hot Notes revision support class with our tutors. For the next 2 weeks, you will be doing the prosthodontics. So as your prosto revision is done from the Hot Notes, simultaneously you're doing some classes with me for important topics. And then very soon in another 2 weeks, the prosto mind maps will also be uploaded. So then you can start reviewing and having a quick recollection of all the concepts through the mind maps. So everything is coming along, all the material that you're preparing first in depth, then having revisions, testing yourself. All right. So you guys can see the screen, the mind maps. So don't worry that if the screen is not zoomed out, can you just read? Let me know that when can you read the main topics and categories of this mind map? Is that visible? Hi Roxana, hi Harnan. Second. All right. So if you can read these bigger topics and subtopics of giving you an overview. What I've already done is that I have scheduled a post on our Facebook group for today's topic quick review. So I'm sure everybody wants to now have a quick revision and that you can recollect all the concepts that you have done. So for the same, I've also created and posted some questions on our Facebook group. So if you're watching now and you want to test quickly, immediately after class, your knowledge, then please join our group. If you haven't already, my team will be posting the link of our group on the comment section in some time. Please join our group and take that short quiz that I've added there. And in this week, at least 2 more times, I'll give you 3 short quizzes every week after the public session, so that whatever we cover in the class, I will help you test it and apply it to the questions and immediately recollect the concepts so they become high yielding and you immediately memorize them and do not then, and so that it stays with you longer during the examination as well. So please make sure that you join the group. Another very important announcement that's coming up is that we have a mock coming. So tomorrow we are releasing our public mock for the month of May. And it's going to be extremely high, challenging, difficulty level would be slightly moderate to higher. So that is why please make sure you join our groups. The links and everything will be provided on our page and our group. And also the discussion class for our mock will be happening this week. So please join the groups if you haven't already for our weekly quizzes. And immediately after this class, there's a quiz waiting for you there. And then the mock is releasing tomorrow, Wednesday. And then a discussion class is coming up within this week only for our May month public mock. All right, so without much ado now, I think many people have already joined in. So let's start discussing the direct retainers. Now, in the last class, we talked about the RPD part 1, just a quick recollection. We talked about the RPD, what were the indications. We predominantly focused upon on the Kennedy's classification. I tested you upon some sample edentulous spaces. I gave you a quiz on that. Most of you performed extremely well and got all the classifications correct. Then we did talk about the various parts, the denture base, the indirect retainers, the auxiliary rest, and how the major connectors can also sometimes be acting like that, right? And then we talked about the direct retainers briefly, the clasps and the clasp assembly. We talked about the minor connectors, the major connectors, the fulcrum lines. We did talk about various kind of major connectors. If you haven't watched the first part, it's available on our Facebook page. You can go and watch the first part and then have a complete overview of RPD, how it's relevant for ADC exam. Because we do not like to waste time on the concepts, because RPD is an extremely vast subject on its own of prosthodontics, but ADC doesn't ask you those questions. So we are doing only high yield ADC relevant topics here at Winspert, and that is why it will come extremely immediately handy to you in exam. Similarly, we have given you all the prosto hot notes on the high yield topics which get asked in exam. No beating around the bush, no doing extra stuff, no just skimming through the textbooks for random concepts which you don't know what's coming, what's not. So it's all targeted, exam specific preparation, right? So all the concepts that I will be explaining to you are elaborately provided to you under the hot notes as well. I'm going to be explaining, and then for your own revisions, you can read and revise through the hot notes and the mind maps both. I will be showing you the diagrams and the pictures as well where relevant. I will be talking about individual clasps, and then I'll also talk about the clasp assemblies. Now, how this is important. Now, this is extremely directly examination concepts. Different kinds of direct retainers, their indications, their challenges, their design aspect, their what design goes in what situation directly gets asked in exam. So now the intention of today's lecture is to know all about the direct retainers, its types, the clasp assemblies, and indications and contraindications. What situations as thrown to you in an SBQ for a particular patient will require what direct retainer. At the end of this lecture, you would, when you look at these pictures, you will immediately know what's going on, which direct retainer is it a direct clasp or it's a clasp assembly. Now, let me tell you, do you want, I know when you look at the pictures, you still get confused with what is a clasp and what is a clasp assembly, right? There is a distinct feature which separates the two, and you're confused, right? You know a little bit overview of it, but after today's class, you will have an absolute understanding by just looking at the pictures what this particular clasp is, or if it's an assembly, which assembly it is. So we'll start with the understanding of the direct retainers, its types, and what are the design requirements. We'll talk about all of these, and then individually we'll talk about in class 3 and 4, which is your tooth-borne RPDs, and class 1 and 2, which is your tissue-supported RPDs, what kinds are selected where. So we're going to talk about all of them. I'm sure you all are ready. All right, so let's start discussing. First, let's know what a direct retainer is. Now, as we talked about the parts of the RPD in the last class, and we elaborated on the major connector, the minor connector, and the indirect retainers, including the classification, denture base. Everybody remembers the meshwork of the metal and the lattice type and the meshwork type minor connector. 90-degree projections from the major connector of the minor connectors. Everybody remember those images? And then the auxiliary rest, the lingual plate, how they act as your indirect retainers. The fulcrum line passing through the most distal abutments, right? The Kennedy's classification, the various maxillary and mandibular major connectors. So I hope that is clear for everyone. Now, what is left with the direct retainers? Its types, its requirements, and what are the indications, contraindications of each design. We are going to be covering the direct retainer in today's class. So basically, direct retainer is also a component of an RPD, and the use and the purpose of having a direct retainer is one single purpose. It is to engage the RPD in place and resist the displacement away from your soft tissues. That means the vertical displacement. So remember, the indirect retainers were working against the horizontal and rotational forces. Everybody remembers here? Give me a yes and no if you remember. The indirect retainers were working against the horizontal forces as well as your rotational forces around the fulcrum line. Whereas your direct retainer works against the vertical forces that gets impacted on your dentures away from the, so all the vertical forces acting on the denture, this direct retainer works against them. So this retentive arm of your direct retainer engages an undercut below the highest contour, the height of contour. There is an undercut which the direct retainer engages and resists the lifting of the denture base against the vertical forces, displacement forces. So that is the purpose of your direct retainer. There are components of a direct retainer. A direct retainer, also known as a clasp. Now remember this thing, one is a clasp and one is a clasp assembly. Both have different design elements and different indications at different sites. Will you remember this much? I'll tell you what are the design differences and what are the indications and uses differences. But first of all, clasp and clasp assembly are two separate, distinct entities. And right now, let's talk about a clasp. A clasp is a direct retainer which includes a retentive arm, a reciprocal arm, a rest, and a minor connector, which is the connecting component between the major connector and the entire clasp here, with the rest, retentive arm, and on the lingual side there is a reciprocal arm. So three components: rest, reciprocal arm and retentive arm, and the vertical minor connector which connects this clasp with the major connector. So far so good. This is clear for everyone. The components of clasp. a retentive arm, a reciprocal arm, a rest, and a minor connector which connects it with the major connector. So this retention that's coming from your direct retainers, right? It comes from the fact that it engages an undercut. Undercut is because every tooth is convex, the depression underneath the height of the contour. Whatever the contour is, the maximum bulbosity where of the tooth is, whatever surface lies underneath it is an undercut. So the retentive arm, by definition, has to lie and terminate below the height of contour. So height of contour is assessed by surveying. When you take the cast and do the surveying, you get your height of contours and you identify your undercuts, right? And then you design where the direct retainer will be given, where the undercut is. Now, undercut can be present on the mesial side, can be present on the distal side, can be present uniformly, can be present on the buccal side, can be present on the lingual side. You cannot decide it. It is pre-existing on a tooth based on its anatomy. That's why what's available, based on that, you will utilize your design of the clasp. It could be engaging the buccal undercut or the lingual undercut. Now, I will also give you, as we move further, for different undercuts, what kind of designs will work. So far, you know that the retentive part has to engage the undercut, so that when the vertical forces act, the retentive arm stays in the undercut and cannot pass through the height of contour, right? So that's the bulge of the tooth which keeps it under that convexity. So the undercut helps the direct retainer to maintain this retention and displacement against the vertical forces. Now, as definition, there are two classes of direct retainers. Most important ones and the most common ones are the extracoronal, which is the design here. But also some non-common ones are intracoronal retainers, which are also known as precision attachments. And the precision attachment has a male and a female component. They are also mechanical, but they are so high precision, they are used only for extremely exceptionally ideal aesthetic situation. But there are many contraindications and disadvantages because they require a lot of tooth preparation and they are not given in your natural tooth. They're always given in your casting of your full crown. So wherever the abutment has a full crown, in that case, a precision attachment will be prepared. The female component will be prepared with the crown, or the male component will be prepared in the casting of a full crown. But there are some disadvantages that it leads to excessive stress buildup on the abutment. That's why it's not very commonly utilized. The most common RPD direct retainers design is the extracoronal one. The extracoronal one doesn't have anything going inside the tooth or the crown, but rather engages the natural surface of your tooth. It's a natural undercut engagement. Or sometimes if a tooth completely lacks any undercut, you can mechanically prepare the undercut with enameloplasty. So that's again minimal preparation. In your extracoronal direct retainers, the clasp can be of two types, suprabulge and infrabulge. One that approaches the undercut from your occlusal component, one that approaches the undercut occlusally, that's called your suprabulge one. And the one that approaches from the underneath or the cervical area is known as your infrabulge, right? So suprabulge and infrabulge would be the types of your extracoronal direct retainers, right? Clear for everyone? So suprabulge which is approaching the undercut from the height of above the height of contour. So if this is your undercut and if the retentive arm is coming from the occlusal surface to engage it, that's your suprabulge. And if the retentive arm was coming from cervical area, gingival area, then it would be defined as infrabulge. Clear for everyone, both types, the suprabulge and the infrabulge? Now, so for your suprabulge, you are approaching the undercut from occlusally, and infrabulge, you're coming from the gingival level. That means the infrabulge is going to have a minimum show in the mouth. That's why where aesthetics are concerned and you want minimal metal show, you would prefer infrabulge retainers. Again, another clinically relevant concept here. Now, what are the requirements of the clasp assemblies? So the three parts of the clasp assemblies are the rest, then it's your reciprocal component and the retentive component. There is a proximal plate as well. So the occlusal rest is designed which gives you the support. So the function of rest is provide the support against the cervical movement of the clasp. So the rest is prepared on the occlusal surface of the tooth and it resists the vertical downward forces. Is that clear? If the retentive arm was resisting against the uplifting forces, the rest is resisting against the downward vertical forces so that the retentive and the reciprocal arm do not impinge on the gingiva. So it provides support and resistance against the cervical forces. Clear for everyone? What's the purpose of your rest? So it resists the downward forces impinging of your retentive arm or your reciprocal arm into the gingiva. Right? Now, clasp retainers, which are used on your abutment teeth, right? Which are adjacent to a distal extension. They are to be designed in a way that there should be no direct transmission of all these forces and rotational forces on the abutment. So suppose this was the distal extension and this was a distal abutment. So that would become a tissue supported, tissue and tooth supported. Class 1 and class 2 is known as your tissue and tooth supported. Whereas the class 3 and class 4 are considered your only tooth supported. So because when you use only clasp and rest is also on the same side and retentive arm is also coming from the same side and the reciprocal arm on the lingual is also coming on the same side, puts a lot of forces on just one surface of the tooth. That's why when you have a class 1 or class 2, you do not use direct retainer clasp alone. You will go for preferably a clasp assembly. For class 3 and class 4, you will use your direct retainers or simple clasps. Whether suprabulge or infrabulge, you can decide. The suprabulge type is your circumferential clasp or your ring clasp, right? Or your embrasure clasps or your hairpin clasps. But infrabulge can be your T-type I-bar. I'm going to show you the images of the same. So when it's only tooth supported, just tooth supported, there are not a lot of forces acting on the abutments because both sides you have natural teeth. In that case, the forces are distributed between two abutments. That's why you can use the direct retainer, which is the C clasp, or also known as your circumferential clasp or Aker's clasp, where the rest and the retentive arm and the reciprocal arm are on the same side, preferable for your class 3 and class 4. It provides the retention from its retentive arm and it provides the stability from the reciprocal arm. Now the reciprocal arm lies above the height of contour because it is not putting any forces or any engagement. That's why the reciprocal arm has to lie on the middle third of the root and above the contour, entirely above the contour. It is also more rigid than your retentive arm. Retentive arm is slightly flexible and your reciprocal arm is more rigid. That's why, because it's too rigid, you do not want it to engage any undercuts. And the function of the reciprocal arm is to provide the bracing, to provide the stabilization. It should never go into your undercuts. So on your second type of your direct retainer is your ring clasp. Now, ring clasp is also a form of circumferential clasp, but it encircles the tooth almost in entirety. It is used when your undercut would not be on the buccal side, right? It is a kind of a circumferential clasp which starts again. It starts as the rest, the arm goes and encircles the tooth from the buccal to the lingual and then terminates here. So this becomes the lingual component is your retentive arm. That means when your undercut would be present lingually, this is your mesial rest, right? And the arm goes and encircles the tooth to engage your lingual undercut, right? So when your undercut is present lingually and the tooth is tilted, in that case, your ring clasp is indicated. So please let me know in the comments if it's making sense to you where the ring clasp will be indicated. It encircles the entire tooth and it's indicated for mesially and lingually tilted molars where the undercut is not present buccally. And in that case, you're engaging it. So if this is your edentulous area, this is your last abutment. So it's your most distal abutment. And in mesial component of it, it's a mesially and lingually tilted abutment. Then your rest is going here on the distal aspect of the tooth. And then buccally, the arm extension begins and circles the tooth, goes to the lingual surface. That means when your undercut is present lingually, right? In those situations, it is used as an ring clasp. Now the indication of the ring clasp is on the lingual side you have the retainer, which is an extension of the main arm only, but that means the reciprocal component is coming from this buccal extension. Is that right? That means the reciprocal component is coming from this buccal extension. So this is, if you do not provide any vertical support to this one, then this would compress and it would be remaining completely flexible. That means there is requirement of some strut. Can you see this vertical strut here supporting this buccal extension? So that makes now this part as a stable component. So this becomes the reciprocal component, and what goes lingually is now your retentive component. So again, this is a clasp with a rest, with a reciprocal component and the retentive component. But unlike your Aker's clasp, it is reversed from the buccal to lingual. In your Aker's clasp, the undercut is present buccally. That's why your retentive arm is also buccal, and reciprocal is on the lingual side. But when your undercuts are present lingually or your tooth is mesially and lingually tilted, in that case, you prefer to use a ring clasp which goes around the tooth, engages the mesiolingual undercut on the lower side, and then the buccal component is provided and stabilized using a supporting strut, which turns it to a stabilized arm and provides the reciprocation. Is that right? Otherwise, because the retentive arm is so flexible, if there is no stability provided here on the reciprocation section, then it would compress under the forces because of the larger length of this clasp arm. So reciprocation and stabilization is provided. Otherwise, it will open and close as a ring, right? You will be having to disengage, and when you try to disengage, it will open up. So you don't want it to be entirely opening up. That's why you give a vertical strut. So this is the lingual view. On top was the buccal view where you saw the strut. Now on the lingual view, can you see here? This is the proximal plate, right? going around and engaging the mesiolingual undercut. So this is your ring clasp. Now the indication, the design, the reciprocation, clear for everyone or not? Because extremely important. Now everybody here present in the class can distinctly tell me what's an Aker clasp and what's your ring clasp. Clear? Now the third important design of the clasp is an embrasure clasp or a C clasp. Now embrasure clasp is kind of like a version of a Aker's clasp only. That is why known as a double Aker's clasp. Again, same components. Can you see here the occlusal view? Two mesial rests, two direct retentive clasp arms, and two reciprocation arms. Can you visualize this? So again, now Aker's design, once it's clear to you, double Aker's becomes super easy. Now you are using double Aker's in situation where there is no edentulous area on one side, on that quadrant, but you still want to use direct retention there. So if there is no, so purely in a class 2 with no modification, would that be right? It allows the placement of a direct retainer where there is no edentulous space. So that means your double Aker's or your embrasure clasp is classic indication for a class 2 Kennedy situation. Absolutely crystal clear for everyone. Now as you're learning the design and you know your classifications from the last class, is it shaping up? Can you now visualize very smartly that in class 3 and class 4 are your tooth supported, tooth borne. So you will use your circumferential or Aker's clasp on both the abutments around the edentulous spaces. Whereas in your distal abutments of mesially and lingually tilted molars, you can go with ring clasp. So that would be in your, maybe in class 2 and a modification where only one distal molar remains on one side, right? Where you have a distal standalone abutment around a modification space, or in a class 3, which is bound by only one distal molar, you would go with a ring clasp where the undercut lies lingually. Clear for everyone? If the undercut was lying lingually, then you will go with a ring clasp. Coming to your double Aker's or an embrasure clasp, it would be indicated where there is no edentulous area and you're using the embrasure or teeth in contact. That means in your classic class 2 where you have distal extension on the one side but all the teeth present on the other quadrant. Can you crystal clear view this? Now, no matter what Kennedys they throw at you in the exam, you are seeing it, whether it's tooth bound or whether it's distal extension. If it's distal extension, you will choose clasp assemblies. If it is tooth bound, like a class 3, you will choose your circumferential or your ring clasp if the molar is tilted. Is that right? And for distal extensions, I will teach you the clasp assembly in a while. But for now, we are talking about tooth borne, and a class 2 on one side is a distal extension. So we'll talk about what you will choose in distal extension of class 2. But the tooth bearing side of the class 2, which is dentate side of the class 2, you will go with your double Aker's or your embrasure clasp. Now there are certain challenges of this, is that the hygiene maintenance is slightly difficult, right? Because of a lot of metal engagement. Right now, this is where you are engaging the embrasure. Buccally, you are engaging the both undercuts with the retentive arm, and the rest goes on both the teeth. And then the retentive component goes on the lingual side, which is rigid and which will not go below the height of contour. Clear for everyone? This assembly, this mesial embrasure clasp here, can you visualize the retentive clasp arms and the rest coming from the occlusion? And of course, on the lingual side, you would have the reciprocal components. Now, do you see this variation of the double Aker's clasp here? Embrasure clasp, but with a variation. Here you see the conventional traditional retentive clasp arm, but here you see a slightly reversed kind of design on the last tooth. Why did you think this design was chosen? because the undercut was not available on the disto buccal, but rather a mesial undercut. If it was a mesial undercut and not present on the distal component, that means the conventional traditional retentive clasp cannot be used to engage it. And if only mesial undercut was present buccally, then you choose your reverse action clasp, also known as hairpin, because can you visualize it does look like a hairpin? Is that right? This design is a classic hairpin, right? A reverse action, you see that retentive arm was going, and then took a reverse, a U-turn. Why did it take a U-turn? Because it was occlusally approaching. It has to come from the mesial rest, but the undercut is also lying mesial, so you have to take a U-turn to engage the mesial undercut. Hairpin, reverse action, or C, because it's forming a C here. It's your C clasp, reverse action clasp, or a hairpin clasp. Now the challenges with this one is that of course it's non-aesthetic, a lot of metal show up, and a food trap, right? That's why it's not a lot of it's not preferred as much. But in situations like these where you cannot come and engage the undercut from the distal component, you have to engage the mesial undercut as a C clasp. Any clasp assembly, Aldo, can be done on the crowns. Okay, if your abutments have crowns and bridges, any clasp assemblies of your RPDs, even the rest seat preparation, the undercut preparation, reciprocal arm engagement, everything can be done even on your crowns and FPDs, but not on implant, Aldo. Never you will give your RPD direct retainers or any indirect retainers on implants, because implants will not be able to take up those external stresses and extra stresses. Is that clear for everyone here? Now here on this picture, can you see it's a 2-unit or a 3-unit bridge here? Can you see that, Aldo? On this image, can you appreciate? It's a bridge here where you have prepared the rest seats, where you have prepared the undercuts, and the retentive arm is also engaging that. That means, but the good thing is that the root is natural. It's a natural tooth, so vertical forces can be taken up by the PDL. But if it was an implant supported FPD or implant crown, then you will not give your RPD direct retainers there. Am I making full sense there? A lot of you have asked me this question on the personal one-on-one doubt as well. So I think it's a good time to clarify this. Clear for everyone? That you will not give these clasp assemblies or clasps on implants, but only on natural tooth, or crown or fixed bridges also can be given. But you cannot give it on Pontics, Aldo. You cannot give it on Pontics, right? It has to be a natural tooth. A Pontic also cannot provide this support or retention. Clear for everyone? Imelda, Aldo, everybody else. Neither on Pontics nor on your implant supported dentures or implant supported crowns, because this is a support providing, bracing provided, stabilization providing component. Has to come, can be on a crown tooth or a restore tooth, but has to be a natural tooth. Okay, not a Pontic and not on implant. So far, please tell me all the 4 types are clear to you. The Aker's clasps or the circumferential, the ring clasp, the embrasure clasp, and the C clasp. Absolutely clear. Now, ADC asks you this over and over again. We'll give you an RPD situation. We'll ask you the Kennedy's classification, and then we'll ask you what should be your clasp design. This is your to the point examination question. And I know now, for any mesiobuccal undercut, you know C clasp. For any class 2 situations on the dentate side, embrasure clasp. For any mesially lingually tilted tooth, it's the ring clasp. And for any normal class 3, class 4 healthy abutment, you will require your Aker's or circumferential clasp. Wonderful, Saida. So clear for everybody, right? So beautiful that now all the clasps that may have been difficult for you to know, confusing for you to know, now you can just look at the design and the situation. So whenever the undercut lies mesial, right, mesially, mesiobuccally, your reverse action clasp or C clasp would be indicated. Now let's talk about these were the 4 different suprabulge type. Is that right? Every retentive arm that you saw in all these 4 came from the occlusal side. Is that right or wrong? So that means this was all suprabulge 4 types. Now, another very important design type is the infrabulge design. What happens in an infrabulge design, that it is a kind of a direct retainer which is preferable for your tooth and tissue borne prosthesis, where it's not class 3 or class 4 but distal extensions. So for distal extensions, it's either going to be your direct retainer, a clasp assembly, right, which would be with your infrabulge direct retainer retentive arm. So let's look at so for class 1 and class 2, which are your only tooth and tissue borne prosthesis, there is only one abutment to provide the support and rest is coming from the tissue. That means a lot of forces are acting on the tooth, because in class 3 and class 4, 2 teeth are sharing that load, but in class 1 and class 2, on the distal extension side, there is only the abutment, single abutments, that's taking up the load. So you require some stress breaking capacity of this assembly or whatever clasp you engage. Now, in the exam, be mindful. If they're saying clasp, that means it's your standard reciprocal arm and your retentive arm situation. And when they use the term clasp assembly, in that it's your rest, proximal plate and the clasp retentive arm. There is no reciprocal arm in your clasp assembly. Recognize this distinctly. When they say only clasp, whether suprabulge or infrabulge, along with the retentive arm, there is a reciprocal arm. That's a clasp, whether supra or infra. In supra and infra, the difference is only with your retentive arm. In infrabulge, it's coming from underneath gingival area, engaging the undercut. And in suprabulge, it's coming from the occlusal surface, engaging the undercut. That's your difference between supra and infra. But the reciprocal arm on the lingual side is same on the middle third of the tooth, rigid, occlusal gingival height slightly broader than your retentive clasp, right? So this is your simple clasp, either your supraocclusal or your infrabulge. But with reciprocal arm, rest, and the retentive arm, rest, retentive arm, and your reciprocal arm. 3 R's, R, R, R. This is your clasp component. Whereas your clasp assembly is your RPI or RPA, which is rest, proximal plate, and the I-bar or Aker's clasp. There is no reciprocal arm in your clasp assembly. That is crucial. I hope it makes sense for everybody. And give me big yeses now that you can see these 2 distinct features. And that's how, when you look at an RPD or a metal framework, you can immediately tell whether it's a clasp or a clasp assembly, right? So now let's talk about the infraocclusal clasp. Not assembly yet. We are still at the clasp, but the infraocclusal. So the infraocclusal bar clasp is a clasp which arises from your partial denture framework. So it engages the undercut from underneath gingival approach, whereas the circumferential clasp comes from your occlusal approach. Now the bar clasp can be of various designs. It can terminate simply here as you see on the picture. Then it's your I-bar. That's the simplest and effectively, hygienically, mechanically the most efficient design because it doesn't have excessive metal show, doesn't have food trapment situation, doesn't engage and connect the tooth or touch the tooth on larger surface area. So mechanically most superior of the Infrabulge clasp. This is your I-bar clasp. Is that correct? And do you see this component? Now this is your proximal plate, and the tooth preparation that you do to engage this proximal plate is known as your guiding plane, right? So the preparation of the tooth is known as guiding plane, and the metal component which lies parallel to this guiding plane is called your proximal plate. Is that correct? So again, proximal plate role is also to provide stabilization, and reciprocal arm provides the reciprocation or bracing effect. And this infrabulge I-bar is your retentive arm. So retention is coming from here by engaging the undercut. Again, it lies below the bulge line. It lies underneath the bulge, this height of contour. So this is your retentive component, the I-bar, and this proximal plate is providing the stabilization, and the reciprocal arm on the opposite lingual side would be providing the bracing and reciprocation. So the other shapes can be T, Y, L, U, S, all non-practical approaches. The I-bar is the most standard, mechanically, functionally most superior, has the minimal coverage on the tooth, minimal display of the metal. So it's an unnecessary requirement to give it different fancy shapes. For an infrabulge, I-bar is the most superior design. Now look at this one. This is a clasp assembly. Can you see the word assembly? Now the moment you see assembly words, what is it that you're going to remember? That the reciprocal arm will not be visible in the design. Is that right? The moment you see the word assembly, please drop your reciprocal arms. Because what happens in your direct clasps, your proximal plate, your rest, your retentive, and your reciprocal, they're all coming from the same side. Is that right? Whether it's infrabulge or suprabulge, it's coming from the same side. Proximal plate, rest, reciprocal arm lingually, retentive arm buccally, whether occlusally approaching or gingivally approaching, they are connected from the same side of the tooth, right? They're all emerging from the same side of the tooth. Is that right? Rest here, reciprocal arm here, proximal plate, and the retentive arm. In the clasp, they are all on the same side. In the clasp assembly, they will split up. Are you with me when I tell you that? They will split up. And that's the difference. RRR, rest, your reciprocal arm and retentive arm, which was the part of your clasp, R will be dropped, and that will become a rest, proximal plate, and a I-bar or Aker's clasp, retentive arm. Reciprocal arm will be dropped. So RRR will become RPI or RPA. And now because there is no reciprocation, the rest and your retentive arm and the proximal plate, they will all split up, right? They will split up. So now this is your proximal plate here. This is your rest seat going in here. And this is where your retentive arm is coming. Can you see any reciprocal arm here? So that means there is a bracing and still stabilization from all the three surfaces. So that means where you have a single abutment taking all the load, class 1 or class 2, distal abutment. That is why the assembly is taking place. It provides more coverage and more bracing of the single abutment. One side the tooth is protected by the rest. One side the tooth is being braced by the proximal plate. And on one surface where the undercut is, you have the retentive component. But reciprocation is still a mechanical feature you desire. So even if you don't have Imelda a reciprocal arm, now the reciprocation is coming from this proximal plate and rest bracing. Understood? Because two surfaces are engaged, one side rest and one side proximal plate, and then the retentive arm is engaging the retentive undercut. The bracing effect is still achieved without having a reciprocal arm. Clear for everyone? So in the clasp assembly, there will be no reciprocal arm. There is a proximal plate, rest, and a retentive arm alone. Three things. So reciprocation is still a feature that you desire, but it would be achieved by your stabilization is now coming because of the full encirclement. Isn't that right? Now there is a kind of full encirclement of your tooth, mesially on the rest, distally from the proximal plate, and on the buccal side or on the lingual side, wherever the undercut is, coming from the retentive clasp arm, most likely the buccal side, right? Clear for everyone? Now this is a picture on the metal, the clasp assembly. Now mesially, this is a distal extension, classic distal extension, whether class 1 or class 2, you're not going with a clasp, you're going with a clasp assembly. Now do you see? There is a mesial rest here. There is a distal proximal plate along with your guiding plane. And then there is an infraocclusal I-bar retentive arm. Clear for everyone? Crystal clear or not? Engaging the buccal undercut. Now, do you see this is the most distal abutment? So maximum forces here. That is why it's encircled from all three sides with your RPI system as rest on mesial, proximal plate on distal, and on buccal undercut, the retentive arm. So three side bracing. Clear for everyone? So now in this case, the reciprocation and stabilization is coming from what? So exam will throw you this question. In the clasp assembly, what is providing the reciprocation? An option is given to you, reciprocal arm and proximal plate and support rest. So what would your answer be? Harparul, do you see any full encirclement here? Do you see any full encircle? Absolutely wrong. Do you, like in a ring clasp, there was an occlusally approaching, going from where the rest is originating and circling the tooth more than 180 degrees and terminating in the lingual. That is an entirely different clasp design. RPI or RPA, can it ever be confused with ring clasp? Please, that is most wrong concept if you get in your head here. So let's eliminate it right away, please. Do you think ring clasp in any ways is an assembly or even similar to assembly? No, assembly is split up. Mesial rest, distal proximal plate, and then one retentive arm. Whereas in your C clasp or your on your ring clasp, you had a mesial rest which had the same side giving you the retentive arm, going full encirclement. Is there any proximal plate on the distal? Is the clasp split up? Harparul, was there clasp split up? Was there any proximal plate on distal? No. You only gave a vertical strut here to support your buccal extension of the arm. So this is acting as a reciprocal arm basically. Is that right, Harparul? The buccal engagement here becomes the reciprocal arm. But here the reciprocal arm and the retentive arm are kind of connected because of this encirclement. Is that right? Absolutely clear for everyone. In your C class or in your ring class, reciprocal arm and retentive arm are still connected because of the full encirclement. But there are still, on a broader view, a rest, a reciprocal arm, and then a retentive arm, where the retentive arm goes lingually and the reciprocal arm has come out buccally, but R are visible. So it's a clasp. Whereas in your RPI, there is no reciprocal arm. The reciprocation effect is achieved with your mesial rest and distal proximal plate. Clear for everyone? Right? And then there is one retentive arm which is engaging your buccal undercut. So this three component thing is rest, proximal plate, and I-bar retentive arm clasp. RPI, clasp assembly. The moment you see the word clasp assembly, your visual should be it goes on the distal extensions, rest and proximal plate split up, reciprocal arm goes out of the window, and just the retentive arm. Clear for everybody? Crystal clear now. Now let me tell you, the moment you see any clasp assembly, you will never forget. All these concepts will always remain with you. Imagine till now, did you have all this clarity against the RPI clasp assembly or even different clasps? Even by looking at it, even by reading it again and again. The indications, the challenges, right? So now you can visualize an RPI or an RPA assembly. Now here also proximal plate distally, rest present mesially. This is the distal extension here. And a buccal, you would have this going on. If it coming gingivally, it's an I-bar engaging the buccal undercut. It's your RPI assembly, rest, proximal plate, and your I-bar assembly. This is your RPI. What is the retentive component? I-bar. What is the reciprocation, stabilization, bracing component? Rest and proximal plate, which are split up to engage the abutment from both mesial and distal side so that to keep it in hold, give a complete bracing so that the abutment doesn't take extra deleterious forces. Now, one important concept to memorize is whenever you're giving an infrabulge retainer, your vestibule depth should be 4 mm, 3 mm below the margin, and 1 mm the thickness of the I-bar clasp arm. So total 4 mm of your vestibule depth should be required. So contraindications for your I-bar would be when you have soft tissue undercuts or excessive bone undercuts underneath in the gingival area, because that will become a food trapping site. If there are deep undercuts and your I-bar is coming, it will become a food trapping site. So that's a contraindication in excessive deep buccal, soft tissue or bony undercuts, right? And if your vestibule depth was also insufficient, less than 4 mm, then also it would be contraindicated because it's coming from below the undercut. You require some dip, and that has to be 3 mm from the gingival margin. Now the second assembly is your RPA assembly. You did an RPI. Now this is your RPA assembly, which is your rest, proximal plate, they will be split up, right? And then your direct retainer. It is just similar to your RPI. Visually, when you occlusally see it, rest on one, proximal plate on the one, but your direct retainer will be coming occlusally, right? So your direct retainer from the proximal plate will be coming occlusally to engage the undercut, And this retentive arm will not be cast one, it would be a wrought wire Aker's clasp arm. Can you remember and memorize it? For your RPA design, instead of the I-bar, you're using a wrought wire circumferential clasp. So the retentive arm is made of wrought wire instead of being cast. Clear for everyone? Same, RPA, mesial rest, distal proximal plate, and a retentive arm coming in, no reciprocation, no reciprocal arm. The bracing and the stabilization and reciprocation is coming from the rest and the proximal plate on the mesial and the distal respectively. And the retentive arm would be supraocclusal or suprabulge, but instead of being cast, that's used with your flexible wrought wire. Simple concept to memorize and know. That's your RPA and RPA assembly, my dearests. And I'm so confident now that you would have never experienced RPD in a way that you did today. More flexibility, absolutely, with the wrought wire. It can engage deeper undercuts compared to your cast clasp arms. It is a wrought wire circumferential clasp arm which has the ability to engage even deeper undercuts. So if your cast clasp can engage 0.01 inch of an undercut, whereas your wrought wire engages 0.02 inches deep undercut. The benefit of using wrought wire, it engages deeper undercuts due to its flexibility. Because in distal extensions, you want the arm to be flexible and not rigid. That's why the cast retentive arm is replaced by the wrought wire arm, because it's more flexible, so less forces on the abutment tooth. And it's a single abutment. That's why reduce the tooth and break the stress as much as you can. Is that right? So stress breaking effect is achieved by two things. Stress breaking effect is achieved by a gingivally approaching clasp, which is an I-bar. And stress breaking is achieved by using wrought wire if you want to give a suprabulge. A cast clasp, which would be a direct retainer circumferential clasp, that's completely cast, which is more rigid, that's used for tooth-borne class 3 and class 4. For distal extensions where there's just one abutment, you would want stress breaking effect. How is that achieved? With your RPI assembly or RPA clasp assembly, which utilizes a wrought wire and not cast retentive arm. Why is it not cast? Why is it wrought? Because this is a distal extension, single tooth. You want to achieve a stress relieving effect or stress breaking effect. Crystal clear or not? Why not cast clasp here? Or why not cast retentive arm here, but rather the wrought wire here? Clear for everybody or not? Because it's a distal extension, single abutment, high stress situation, you would not use the cast clasp retentive arm here as a circumferential clasp, but rather achieve the retentive arm supraocclusally from a wrought wire, which is more flexible, so less force is acting on the abutment tooth, stress breaking effect achieved. I-bar is always cast in your alloys. It is cast. It can never be made from wrought wire beam. Clear for everyone? I-bar or infrabulge will always be casted, will never be wrought wire. Only the supraocclusal one can be wrought wire. Right? Ravani, do we have a reciprocal arm in our RPI or RPA assembly? No, right? So if you're talking about simple clasp, like a circumferential clasp, which has a reciprocal arm, that will always be cast. Now, that brings me to a combination clasp. Do you want to learn about another clasp? It's not a clasp assembly. That's why we kept it at the end. This is only a pure clasp, not an assembly. So that means it will include what? When you see the word clasp, can you please tell yourself it's RRR? Tell me, everybody. When you see the word just clasp, can you please start RRR? And when you see the word clasp assembly, can you remind yourself of the word RPI or RPA? In RPA, the A is made from wrought wire because you require the flexibility and stress breaking effect. Now, when you say the word clasp and you say the word combination, the beauty of it is it's a clasp. So it has a rest, reciprocal arm, and retentive arm. By definition, combination clasp means that the reciprocal arm would be cast and the retentive arm will be made of your wrought wire. That means because both cast and wrought wire situations are coexisting, this would become a combination clasp. Whereas in your standard circumferential or Aker's clasp, when you have RRR, your rest is also cast, your reciprocal arm is also cast, and your retentive arm is also cast. So the entire clasp is made with the wax and then sent to for the casting. But in the combination, your casting will bring you only the rest and the reciprocal arm, and then wrought wire will be soldered. Wrought wire is always soldered as a retentive arm. Now clear for everybody? Combination is a type of an Aker's where the retentive part is replaced with the wrought wire, but the rest and the reciprocal arm will always remain rigid, so they will always be casted. Clear for everyone? And when you have your conventional Aker circumferential, both your RRR, all three are casted. In combination, rest and reciprocal are casted, and the retentive arm is fabricated from your wrought wire, which will be soldered to the assembly. Now, good question, Varsha. Exam asks you the same question. These are the kind of questions which show that you're going ahead, thinking more and more now. Wonderful question. So now talk about it, Varsha. Your periodontally weaker abutment would require what kind of feature? Maximum stress breaking. Is that right when I say that? Your periodontally weaker abutment will require the maximum amount of stress breaking. Isn't that right? So first of all, let's choose between the broader categories, clasp and clasp assembly. Now tell me, which has the minimal bracing, minimal metal contact with the tooth structure, clasp or clasp assembly, RRR or RPI or RPA, which has the minimal engagement of the tooth physical contact? Varsha, clasp versus clasp assembly, which has the minimal forces acting. You can tell from the concepts that we did. In class 3 and class 4, you're using clasp, right? In class 3 and class 4, where the abutments are stronger, you can use clasp. But where you have only single abutment situation, class 1 and class 2, higher forces acting, you're using your RPI or RPA assembly. That means the assembly is better where there is high stress situation. Isn't that right, everybody? Shravani, rethink about it. In high stress situations, clasp works better or assembly works better? In class 3 and 4, less forces coming on abutment, that's why you're giving clasp. But in class 1 and class 2, more forces are coming, so you prefer assembly. Is that right or wrong? Tell me. Shravani, you tell me. Anybody else who wrote clasp only? Jasmine, you wrote RRR. Tell me. When you have heavy forces, you preferred clasp or clasp assembly? Think about it. Assembly is multiple people collecting together. That means when more forces, more stresses, so prefer an assembly or a single clasp, right? So that means, first of all, when you have a question of periodontally weak or abutment, first choice would be assembly. Then a simple class where all the components are on the same side, putting harmful forces from all one side. Agreed? Everybody, agreed or not? Makes sense or not? Fully, now this is a complete application going full circle around the lecture. You're going full circle around the lecture. All the concepts that you learned, you're applying it here. Class 3, Class 4, Clasp. Class 1, Class 2, your Clasp assembly. Now, periodontally weak abutment is also a high stress situation. So you want to break the stress as much as you can. Reduce the stress as much as you can. That means the Clasp assembly. Okay, if you have shortlisted the broader category, now let's go into RPI and RPA, which has even lesser forces. Supraocclusal arm or infraocclusal arm of the retentive arm, which has even lesser forces on the abutment tooth. Anuja, compare your I-bar and compare your circumferential. Forget about the material in circumferential. By design, both of them, which has the lowest force? RPI. So from that assembly also now you have gotten with the minimum forces acting on that periodontally weak abutment. Right? Now, can I tell you one very beautiful fact that when we did this question in our ultimate advanced file, this is an ultimate advanced file question, actual exam question, right? I have a reference, I found a reference, and I'm going to upload it maybe on our WhatsApp public group. I will upload it on our Facebook group. I will share it with you on our internal group. We have a reference. Now, beautiful. Keep listening and you'll be like, aha moment. There was a study done. So it's not just by logic. It's not just by understanding. They actually had studies done with different clasps on periodontally weak abutments and found the forces actually taken up by abutments. And by result, they found that the cast RPI assembly, even compared with your wrought RPA assembly, had minimal forces on the abutment tooth. Now, would you like to or would you love to look at that reference, the study that supports your conceptual logical reasoning? So I'm going to upload that reference on the public WhatsApp group, on our internal WhatsApp group, and on our Facebook group, wherever you follow us. You will look at that reference to seal the deal. And now the questions are waiting for you on the Facebook group. Please go attempt them to further practice the application of the concepts that you just learned. And that, my dear, ends today's lecture with the complete exam related RPD and its parts, set 2-part RPD related lecture. Okay, so this is all that is to be learned for the ADC exam, that you have completely covered, understood, and not just understood, but you have learned it in a way, you have understood in a way that it has been broken down to simpler bite-sized concepts, and it makes sense and it layers up. So whenever you see any RPD images, whether it's classification, whether it's major minor connectors, whether it's fulcrum lines, whether it's indirect retainers, or now your direct retainers, clasp or clasp assemblies, you have mastered RPD inside out. Right? No. In your periodontally weak, you are not going to split up the load by giving embrasure clasp, because embrasure clasp is still an occlusally approaching cast clasp, Anushta. That's extremely stressful. That's why you only use it for 2 dentate situations, in fully dentate situations, right? When 2 teeth are taking a clasp load, that means there is excessive load from the clasp itself. So actually counterintuitive to what you're saying, Anushta. Embrasure clasp, that means has a lot of forces, 2 kind of retainers, 2 retentive embrasures. So on any periodontally weak abutment, you will not try to bring clasp alone because they are high stress on abutments, right, Anushka? So think like that. Clasp requires a lot from the abutment, right? And clasp assembly brings a lot because of its assembly components, right? So it actually supports the abutment. Whereas a clasp requires and takes up all the support from the abutment. So clasp likes to take and assemblies like to give. Think like that. So when you have class 3 and class 4, your abutments have a lot to give. That means use the clasp. But in your distal extensions or periodontally weak abutments, compromised abutments, your abutment doesn't have a lot to give. So you have to get an assembly which has a lot to give to your abutment. Does that make sense now, Anushka? Think like that. When you think like that, what is more draining, what is giving, what is receiving for an abutment? A clasp will take from the abutment, clasp assembly will provide to the abutment. Clear for everyone? Watch the class again. All the concepts will come back together beautifully. And I'm sure you have applied and learned most of them. Please take the questions to also now test yourself. 3 questions are waiting for you. And in the coming days, I will post at least 3 questions more, maybe after a day, and then 3 questions more. So 2 more times I am going to take your quiz on the same concepts so that in the exam, you immediately know entire mechanics behind it. The rest always remain on the mesial side on the RPI and RPA? Yes. Yes, because the force is lot on the distal surface kinza, right? That's where the entire distal extension is. So mesially, the rest will brace the abutment from the mesial component. And the proximal plate arises from the minor connector, which is on the ridge, whether the mesh or the lattice work. So the proximal plate will arise from it on the distal extension. So see this? This is your rest. This is where your proximal plate will come. And buccally, from this same minor connector, you will have either supraocclusal or infraocclusal clasp kinza. Can you see this on the picture? Right? So wonderful. Thank you so much, everyone, for being a wonderful, receptive audience, very engaging audience, and you showed so much strength by receiving the concepts and not getting confused, not getting overwhelmed. Thank you for listening, paying attention, and grasping. And take the quiz and just a review and just a quick repetition that yes, the free mock is tomorrow, and you know the Winspert mocks are the toughest one out there. Students struggle to score, so that's what you need to get challenged, to get met with the questions and the concepts that really matter in exam. So that kind of high value, we bring our public mocks only after few weeks, and we don't throw at you just silly, simple questions just made randomly, because we do want to give you a challenge. We do want to, stimulate, and, we don't want to mock your acumen. We want to really, really appreciate and challenge your acumen, and then help you test your knowledge once you've gained it over a month, and then apply it to our public. So that's the reason that we are very strategic when it comes to when to bring a mock and about what subjects to add on it. So we are extremely strategic about it. It's no random every week, every second day kind of mock that is just, any random question created, which is not even challenging you and you can immediately pick up the answers. We want to prepare. So if you keep taking mocks over and over every second day, you are not focusing on knowledge, you are not focusing on developing the concepts. This exam cannot be cracked by just simply reading textbooks alone or just by doing random baseless mocks every day. It requires a strategic combination of daily, weekly preparation and then strategic, hard level, challenging mocks which corroborate with your preparation, which work around your preparation, and which have developed in a logical, thoughtful, and a strategic manner. At Winspert, we promise you the full 5 months and 22 weeks of strategic growth and not a random chaotic pattern. That I can promise you, that I can assure you, that I will deliver to you every class and every mock at a time. So your next strategic mock is waiting tomorrow. And then a discussion class will also be this week. And your quiz for this lecture is also waiting for you on the Facebook group. Please go ahead and take it. I think it would be published now. And then I will see you for our internal class this week, which would be on Thursday. Then you have 2 tutor support classes for internal batch, one tomorrow with Dr. Kalai to finish the endo hot notes revision. And then on Sunday, you have your prostho hot notes revision. Thursday, we have our your pedo and ortho mock discussion. And the mock test Imelda will be available for our free candidates. It would be available under the free course on the app. And for our enrolled candidates, it will be available on their paid course on the app. So on the app only, both the mocks, the public mock will be available from tomorrow. And if you have not enrolled with our course, then it would be under the free mentorship course. Imelda, I don't know, I think I've seen your name on the enrolled course. Can you just tell me whether you're enrolled or not? So yes, tomorrow's mock is a free mock. It would be available under free mentorship course. Okay? And also for our enrolled candidates under the public mock section on their own paid course. Clear for everyone? All right, if you have more questions, please feel free to message me. Thank you so much, so much for being the fabulous audience that you always are. Have a great night and happy learning, everyone. See you soon.